approached me at different times and asked me to do this presentation, and so prayed about it, thought about it, and then I got a call. You can't say no. I'm working today. I was like, okay, fine. We'll put something together, and whatever God puts on my heart, that's what we'll do. Okay, so before we start, I've been taught to start everything with prayer. That's the core of everything we do. Healthcare. Jackie, I see you. I see a lot of familiar faces here. Amazing. That's awesome. Okay. If you don't mind, just bow your heads a little bit and we'll start. Heavenly Father, we thank you for bringing us together. Lord, you said where two or more are gathered in your name, there you are in your midst, and we believe you're here today. Father, I thank you for this opportunity to gather, to worship you, and to fellowship together. Lord, use me to tell this family we have gathered here how you want them to live, health-wise. I don't have anything to give to them, but you're going to use me to give them something that they will take from here and be able to use in their lives, in their families' lives, in their friends' lives. This we ask. In Jesus' mighty name we pray. Amen. All right. So, am I doing this? Do you have a remote to? Okay. Well, you got it. Okay. So basically, the things that I want to talk about today: hypertension, diabetes, heart disease, cancer screening. We'll talk about a little bit in preventive medicine. Okay. These are just a few topics that I kind of just put together so that we could talk. And I want this to be a forum where we exchange experiences, exchange knowledge, exchange some of the things that we've been told, that we believe, that we we hold on to strongly, but that might be a little different here. And if there's anything up here that you're not comfortable with, or you have any questions, just stop me in the middle and we'll kind of go over it. And the pulpit to me is very special, so I'm going to kind of step back here and I'll be amongst you guys if you don't mind, okay? I'll leave that for the pastors to do their work for me. Okay, so I hope nobody minds. Okay, and if I need to stand up here so you can all see me, I'll do that. But I'll be walking up and down and stuff like that. Okay. Go to the next slide, please. So let's start with hypertension. So how do we diagnose hypertension? So normal blood pressure is 120 over 80. How many of you are normal here? Okay, yeah, claim it. You better claim it. Everybody, I want to see all the hands go up. Okay, so if your blood pressure is that you're 120 to 129, or a little bit higher than what we'll consider normal. We call it elevated blood pressure. Okay, they've just changed. I think Jackie, you could side with me here, right? They just changed the recommendations just this past year, and so it's put a whole lot of people into this range of what we call hypertension. And the reason for that is when they look back at people who've gotten sicker in their later on in life, they've all had some form of hypertension, whether it's just the elevated blood pressure or stage 1 hypertension. Those numbers are the first stage of hypertension over there that you see, the 130 over the 130 to 139 over 80 to 89 was never considered hypertension. That was always considered normal. But today, if you fall in that range, you are in the first stage of hypertension, and it could mean your blood pressure could become higher later on, or you could have consequences from this. Okay. Go to the next one. So the second stage is what we actually diagnose as hypertension, which is 140, anything above 140 over 90, which has been the traditional diagnosis of hypertension. So as you see, things have changed. And this definition is really based on measuring the blood pressure not just once, but several times, okay? Now, if you go into your doctor's office and your blood pressure is it's greater than 180 over like 100 or 110, you're probably a hypertensive, okay? And at that point, no arguing, no, I'll come back in a month, no. You have to sit down and come up with some kind of a plan on how you're going to move forward, live your life, and live it a healthy way, because those are very dangerous numbers, and we've seen some catastrophic things happen with people. And then on the other side, you see that if you have heart disease, kidney disease, or some kind of eye disease, and when I'm talking about eye disease, I'm talking about there are some hypertensive eye diseases that people will be diagnosed with. There are people who go see the eye doctor, and the eye doctor will say, you need to go see your regular doctor because you're probably hypertensive. And if you hear that, that means that you're in this dangerous range, okay? And the diagnosis is pretty much made, okay? But just in general, the thing to take from this slide right now is that you need these measurements to be done several times to be diagnosed with either a stage 1 or stage 2 hypertension. The elevated blood pressure, you have to know that you are elevated, and there are things that you want to do in your life to change those numbers. You want to change your lifestyle. And that's what this is all about. It's not about me preaching to you. I'll tell you personally, I am a hypertensive, okay? I am a hypertensive. I've been a hypertensive since I was 25 years old, and I've been on medication for that period of time. So it's something I kind of hold close to my heart, that we take very seriously. I'm Ghanaian, I'm from Ghana, and hypertension is one of our silent killers in Africa. I mean, well, we usually hear, for those of you from third world countries and stuff, oh, someone was complaining of a headache, they went to the hospital, and now they're dead. Yes. This is it. High blood pressure, okay? And unfortunately, it's taken quite a few of my family members, and so I take it very seriously. I make sure that I take care of myself, and that my blood pressure is better. I think even with medication, I'm in the elevated rate. No, I'm kidding, let's go. You could go to the next slide if you don't want. What are your risk factors? Meaning, what kind of things do we look at? You could put all of those up there. The first thing is old age. I mean, unfortunately, as we get older, I'm sorry, but as we get older, the chances of us developing hypertension increases. Okay, obesity. I don't like using that word, but if you are on the heavier side, I mean, your risk of having high blood pressure is also up there. Family history, like in my case, if your parents, your mother and your father have high blood pressure, your chances of having high blood pressure is probably twice that of the regular person. We have race up there because African Americans are, we have hypertension runs in black people, period. And unfortunately, when we are diagnosed with it, a lot of times we have some of the end stage kind of problems that come with it. Heart disease, kidney disease, eye disease, things like that. So it's very important that we pay attention to this. Get your blood pressures checked, make sure your kids get them checked. I mean, it took me a couple of years to actually admit to myself that I was actually hypertensive, and it was after I finished med school that I finally got on medication. Throughout med school, I was a little bit on the higher side, and I was like, it's probably the stress of med school and, you know, working so hard and all of this kind of stuff, making all sorts of excuses. But it runs in the family. You have to think about it. Okay. And our diet. I mean, our wonderful ethnic foods are loaded with sodium. Loaded. And so you have to pay attention to that. When we talk about the diet, also the canned foods that we eat, I mean, it's no coincidence that they put low sodium on some of the things, because most of the regular stuff that we like is full of sodium. That's what really gives it a good taste and stuff like that. Excessive alcohol use, I mean, goes without saying, that will cause your blood pressure to go up. Alcohol is a funny one, because in the treatment also they tell you maybe a little tiny bit of wine here and there might help your blood pressure. I mean, it keeps changing, so you know what, just stay away from it. And we're Christians anyway, right? Amen, right? Okay. And then being inactive physically. I mean, you know, we all like to get out of the house, get in the car, drive to the store, come home. You want to get a closest parking spot when you get to work, closest parking spot when you go to the grocery store. We use the elevator, no stairs. These are all things that really play a role in blood pressure staying up, and we need to learn how to make some lifestyle changes. Okay, to the next slide, please. So what I have here is essentially medications and stuff that could be affecting our blood pressure. I didn't completely gear this towards women, but it's for all of us. Okay. Oral contraceptive pills could sometimes make your blood pressure go up. So when you know, your doctors ask you to come back and be evaluated again in a month after you get your medication, please do that. Medications that we take, over-the-counter medications, specifically we call some of them non-steroidals, NSAIDs, ibuprofen, naproxen, just a common aspirin. They could all cause your blood pressure to go up. So it's just, if you are someone who has like back pain, or you have some arthritis and you take these routinely, and they keep checking your blood pressure and it's high, this could be contributing to it. Doesn't mean you shouldn't use it, but you should be aware of it. Okay. Some of the antidepressants could cause your blood pressure to go up. I say steroids, I don't mean the stuff that the bodybuilders use, but you know, like things like prednisone and other medications that we use for common medical issues could cause your blood pressure to go up. The big one is decongestants and like cough medicines and things like that. They are loaded with medications that the way they work is by constricting your blood vessels, and that will cause your blood pressure to go up. So if you have high blood pressure, you should be aware of that, especially in the flu season and, you know, the cold and cough season, etc. We tend to just pick whatever is available on sale on the rack in the pharmacy, and it could be affecting your blood pressure. You just need to pay attention to that. You take those medications, the next thing you know, you have a headache, and then, you know, and you're like, why do I have this headache? Yeah, your blood pressure is high. It's not because of the cold. So just be aware of that. And you know, some of the same medications that we try to use to help ourselves to lose weight and things like that could also cause your blood pressure to go up. So be aware of that as well. You could go to the next slide. So what are the things that we could do to kind of help our blood pressure, you know, just settle down a little bit before we end up in this stage of stage 1 or stage 2 of hypertension. So the first thing is, you know, really the salt stuff, okay? Salt. How does salt work? You know, the more salt you take in, the more water you drink. The more water you drink, the more what? Essentially, the more volume you have, sometimes we eat certain things and then our feet swell. That's why, because the volume in your body increases with that. So that causes your blood pressure to go up. So if your feet are swelling, that means you have too much salt. No. Yeah. Realistically, if the salt in your diet is high, and if you're adding extra salt to your diet and stuff, it's something that could be dangerous. If you have high blood pressure, that's something that you should definitely not do. If you are in the elevated range, 120 to 129, over 80, a little bit over 80, then these are things that you could do to kind of help your body fight the hypertension. Okay, restrict the salt. There's something called DASH diet, or it's a dietary approach to stopping hypertension. Basically, it's healthy foods. Okay, fruits, vegetables, nuts, fish. Staying away from some of the red meat and stuff like that. Okay, there's a new thing where they're supplementing, they're giving people extra potassium now to help their blood pressure. It seems to work. I wouldn't say go to the store and buy a whole bunch of potassium and just keep taking it. That could be dangerous as well. But eating 1 or 2 bananas a day is not a bad thing. And so, just kind of giving yourself some of the natural potassium. And that's from fruits, vegetables, greens, things like that is good. Weight loss goes without saying. When I was diagnosed with high blood pressure, I was like, okay, so I'm really skinny. What is going on here? I was about, I think 100 and, I'm 6 foot tall, and I was about 165 pounds or so. So I was like, I can't lose any more weight. I look like a beanpole. So at that point, I was exercising and I was doing everything I could. But if you are overweight, and we have all these charts that says BMI, it says, okay, my BMI is 28. Okay, that means I'm a little bit on the higher side. My BMI is 35. Let's say, well, in my family is this big, and we all look the same. And our BMI is a little bit different. No. Do something, get into an exercise regimen. We have to do something with our diets and stuff, and all of that will help the weight loss, will help you lose some weight, and will also help the blood pressure. Exercise is great, okay? And we're not necessarily talking about going to the gym. Take a walk, okay? Go to the mall, leave your purse in the car. Walk all the way around upstairs, and then downstairs, walk around, and then go back to the car. Okay? Leave the purse in the car, please. What did you say? Leave your husband in the car? No, you have to leave. You have to be walking behind her, hopefully. No. So the recommendation for exercise is 150 minutes a week. Okay. Basically, if you do about 20 minutes of walking every day, you will get the kind of exercise that you need. You start off slow, and then you want to break a sweat. I don't mean walking at midday when it's really humid out. Pick the evening, when it's nice and cool out. Get out there, get a brisk walk in for about 20 minutes, and that's usually very good exercise. Your heart rate will go up, and you'll burn some calories that way too, and it's good. You'll feel good. Trust me. Go to the next slide. Pharmacotherapy. Basically, this is about medications. I didn't put the specific medications here because I don't think that matters much. there are certain people that we start on medications very early. We don't mess around with the diet, the exercise, the weight loss, all of that stuff. If you're a diabetic, we immediately try to go to medication. I mean, of course, we want you to do all the other things too, but we can't wait because your body's already being attacked by one disease. We don't want the second one to cause problems. If you have heart and kidney disease, that means that it's pretty advanced, and so we need, as far as your hypertension is concerned, so we need to get on top of it quickly. And also, if you're over 65 years of age, we tend to go to the blood pressure medications, just because it just, most of the time it means that you probably had the high blood pressure for a long time. We can't sit around and wait, for things to happen. We need to bring it down to safe numbers and give your body a chance to live healthily for the days that God has given you. So it's essential, and the nurses in the room, I should say the providers in the room will agree with me with this. You have to be compliant 100% of the time. It's really tough to be taking medication, but it's really important that you take the medication every day the way it was written, okay? You can't skip doses, it's dangerous, okay? That's why I put that third place in. It's a team approach. It's you, the patient, and your doctor, your nurse practitioner, whoever is helping you, your nurse. You have to communicate, okay? If it's hard for you to take a medication twice a day, we have options. Tell your doctor that. You go in there, one day you go in, the blood pressure is good, the next time you go, it's 40 points higher. It's like, what is going on here? Oh yeah, I missed the dose. If not, they'll give you another pill. That's what we do, unfortunately. So it's very important to have a good relationship with your providers. Talk about side effects, especially the men. We tend to just say, yeah, I'm taking the medicine, not taking it, and then, you're having side effects and stuff, so you're not taking it, you can't, you can't be intimate or whatever it is. You need to talk about anything that you feel that could potentially be a side effect. Talk to your doctors about it, because sometimes we could take you off that medication. What some people will do is they won't talk about the side effect. They will keep taking the medication, and something disastrous will happen. Okay. One of the first medications I was put on, I was so tired on it. I was always tired. And so I went back to the doctor. I was like, I don't know what's going on, but in the middle of the day, I have to stop and literally take a nap. And it's like, okay, we need to change your medication. And that's all I needed to say. So communicate with your doctors, communicate with your providers, your nurses, and remember that all the medications we're putting in your body are doing things to you, and they could be doing dangerous things to you as well. The last thing there, it says stopping medication suddenly is dangerous. I can't, Jackie, you work in the ICU. How many people have we seen in that ICU because of them just stopping their medication suddenly? It's incredible. Strokes, heart attacks, death. If you're on blood pressure medication and you stop it suddenly, you could just bleed into your brain, and that could be it. So, and it's, for us Christians, it's not death that we're afraid of, right? It's actually living, paralyzed to a certain extent, God put us here to have a healthy life, right? We have to also play our role in that. Take responsibility for your health, take responsibility for your life. If you have to partner with your doctor, you have to partner with God. If God puts on your heart that, look, I want you to eat better, you have to obey, Just like if God gave you a prophecy to tell your sister, you'd be walking over there and telling her right away. God puts a prophecy in your heart, say, I want you to eat better, just make the changes that you need to make. So stopping medication suddenly is very dangerous, and so we should never do that. You want to talk to your doctors or nurse practitioner nurses before you do anything like that. Okay. Let's go to the next slide. Okay, diabetes. That's another big one. You can put everything up there. So the diabetes we usually see in our age group, the older ones of us here, is type 2 diabetes. That's the adult onset. There's this new diagnosis of something called pre-diabetes, which is something that they just kind of put out there in the last few years, because they've noticed that people whose sugars and stuff have been running on the higher side end up developing diabetes and the complications from it. Type 1 diabetes is, unfortunately, we see mostly children, adolescents, and young adults. And that is essentially your body fighting against itself. Your body makes what we suspect are antibodies or something that kills off the cells that makes insulin in your body. Okay, so your body can't make any more insulin. And so your body, you have to give yourself insulin. So people who are type 1 diabetics, it usually starts in childhood or adolescence. They end up being on insulin for the rest of their lives. The type 2 diabetics are usually, a lot of it has to do with weight. We're seeing that more and more in kids now because of all the wonderful sugars that we're giving our kids. The soda, the juice, we keep telling the kids, stick to something that's clear, stick to water. Clear doesn't mean Sprite. Stick to water. If you can't see through it, you shouldn't drink it. Stuff like that. The weight gain in the kids now is incredible, and part of it is also the games, the wonderful games that they like to play. What's the new one? Fortnite. Yeah, my kids live on it all day, and it's terrible. So they don't go outside, they don't get any exercise, they gain weight, and then they end up with diabetes. At a very young age. So we definitely need to pay attention to that. A lot of that has to do with weight, and the pre-diabetes is again the high insulin, is the high glucose levels and stuff. Go to the next slide for me, please. So how do we diagnose diabetes? First, there are three things that we use. Okay, there's fasting blood glucose, so that on all the way on the left-hand side, what you see there. If the doctor sends you for a test and tells you to fast, don't eat anything after midnight. They draw your blood. If it's more than 126. You're probably a diabetic. If it's more than 100, they're calling it pre-diabetes now. So that's saying that you're in a dangerous range, and you need to make some lifestyle adjustments, okay? And if it's below 100, then you're normal. If there's something called a hemoglobin A1C, it's a fancy word for saying that, there's a protein in your blood that if your sugar is too high, it kind of the sugar kind of sticks to the protein. Okay, so if your hemoglobin A1C is high, it's above 6, you're above 6.5. Really, you're a diabetic. If it's below 6.5 but above 5.7, then it's pre-diabetes, and if it's below that, then you're normal. It's that hemoglobin A1C, you probably will not be seeing, your doctor will probably not just draw that on you unless you're a diabetic. It's something that we use to follow diabetics. Now, at any point, if someone draws your blood, and your blood glucose is more than 200, you are a diabetic. There's no ifs, ands, or buts about it, okay? If you're above 200, you're a diabetic. That's it. Don't try and be like, well, I ate this and I drank this and I did this. No, your body is just not processing the sugar very well. Usually when we see that, the next thing we would do is we would do that hemoglobin A1C, and that tells us how bad your sugars have been in the last 3 months or so. Okay, Smell that wonderful Nigerian jollof. Do you have any Ghanaian jollof here? Which one is better, Nigerian or Ghanaian? Oh yeah, okay, all right. and the battle continues.
You only have one.
What?
Only one person on your side.
Oh yeah? Okay. Just one person? Oh, I think we can still win this one. Okay, so that's my thing on the diabetes diagnosis stuff. Go to the next slide, please. So what are some of the symptoms and stuff? And I look in the bulletin that was made. The diabetes is spelled out there, and I think this is some of the same stuff that was in there. So the biggest one is frequent urination. If all of a sudden you find yourself urinating pretty frequently, and it usually doesn't just go with the urination. It's you're extremely thirsty, you're drinking a lot of fluids, and you're urinating a lot at the same time. That's your body telling you something. Okay, and that's your body is just trying to get rid of the sugar of the glucose, and the way it does that is it pees it out. You know, your body just gets rid of it in your through your bladder. So you'll keep drinking, and you can't quench that thirst. A lot of people will come in complaining of their vision. I need to go see my eye doctor. You go see the eye doctor to tell you, your eyes, I don't think it's your eyes. You should go see your doctor. Here we go again, right? The eye doctors diagnose a lot of stuff, and we kind of blow them off sometimes. You go, you're like, yeah, my vision has changed. Let me go get that checked. You check it and say, go see a doctor. That means there could be something going on. So, blurred vision, extreme fatigue, you cut yourself or you bruise and it heals very slowly. So those are all signs that there's probably something going on with your body as far as the sugars are concerned. It's important that you get that checked. With the type 1 diabetics, I mean specifically with the kids, what we'll see is that all of a sudden they're peeing a lot, you know. With the very young kids, not very young kids, you might have a preteen or a teen when they present with the diabetes. A kid who has been doing well all of a sudden will wet the bed. You're like, what is going on? They need to be checked. Okay, you know, that could be a sign that there's something going on. If a kid is peeing a lot and losing a lot of weight, it's very important that they get checked also. With the type 1 diabetes part, you know, we're talking about weight loss, all of these things that change. The kids that we really have to pay attention to, you know, the little kids, of course, we are always kind of helicoptering around them. We are always around and checking on them and stuff. The teenagers and the college kids, we tend to kind of forget about them when we're talking about these diabetes and the symptoms and stuff. In type 1 diabetes, that could be very dangerous. You know, some of our college students like to have their own room in college and things like that. You know, sometimes it might not necessarily be the best thing. They want to live by themselves, and no, might not necessarily. It's not a bad thing to have a roommate, because when things happen, you have someone there to help. I unfortunately lost a family member, a cousin of mine. This was years ago. Was in college, and no one heard from him for a couple of days. They went to his room, and the Lord had taken him, or I should say, the diabetes had taken him. He didn't know he was a diabetic. You know, he had all these changes going on. Nobody really understood what was going on with him. He went to sleep one day and died. Diabetic coma. Okay, so we need to pay attention to every. You know, we're a community. We are a family. We are a village. We need to just keep an eye on everyone. Just check on each other. Call, talk. You know, have somebody to call if you can't get in touch with them. You know, Mom will call 3, 4 times. Where's Ori? No. She's not here. Okay. All right. But you know, it's important that we, especially when you send the kids away to college and stuff, they sometimes will say, "Oh no, I want my own room. I want this. I want that." You know, it's not a bad thing to learn to have a roommate and to take care of each other. Those of us who went to school in third world countries and stuff, and we lived in big dorms with all of us in there, and, you know, but we took care of each other. You know, our older, you know, students and stuff took care of the younger ones. They were our older brothers, who were they bullied us, but they also made sure that when we were sick, we were taken care of and things like that. There's nothing wrong with that, you know, having a community to live with. Okay, and the last thing on the list, and I'm kind of going into tangents here, but it's all in fun, is tingling hands and feet. That's usually something we see in the type 2 diabetics. You know, when your sugars have been high for a long time, it starts to damage your nerves and stuff. If you're starting to feel the tingling in your hands and your feet, and you have some of these other symptoms, it could be that. It could be diabetes. You should get it checked out. Okay, if you're here, and I'm talking to a lot of women here, but if you hear your spouses doing that, saying that, you know, it's like, yeah, I'm making an appointment for you. Don't tell him to make an appointment, because you know what we say, right? All right. Never happens. Okay. Can you go to the next slide, please? So let's talk a little bit about the risk factors. Again, it's repetitive here, but obesity is a big one. If you are overweight, the chances of having type 2 diabetes are high. If it runs in the family, hereditary. If your parents have it, if your siblings have it, you probably are at risk for it and should be watching how you live your life, because if not, you will end up in the same situation. Okay, it's unfortunate, but sometimes we see the same family members, and you know, over and over again. They're here one week, their brother's here the next, their sister's here the third week. You know, and it's horrible. So just we all always, as a family, we do everything together. So when we have bad habits, we learn all of them together too. So you know, if we're going to do weight loss, low salt, whatever it is, we have to do it as a family as well. Okay. So treatment, what do we do? Again, this is getting kind of old, but diet. Watch what you put in your body. You know, watching the calories. You know, and a lot of times, I mean, you talk to the dietitians and stuff like that. It's not necessarily about what you're eating, but how much. Okay, portion size. We sometimes like to eat until we are full. You know, we have those nice, beautiful, big plates. We have to fill it up. You know, and for my African brothers and sisters here, we love those carbs, and they're killing us. You know, back home, yeah, you like your eba, right? So back home, you know, you eat all of those carbs and stuff like that, and then you hit the streets and you walk to the bus. Yep. And you walk from the bus to, you know, you keep walking. You walk miles before you get to work or school. Here, you eat all that good stuff, get to your garage, get in the car, you know, get in your car, drive, get the best parking spot closest to the building. You 2 stops and you're there. And you get out, you go to the grocery store from there, and then, you know, again, you park very close, and then it's the same, it's just bad habits. Okay, so diet modification, weight reduction, which means just exercising. You know, you don't want to be on diabetes medication. They do bad things to your body. Okay, you know, I don't want to go into the details and stuff like that, but if you could do this by exercising, by diet, by changing your eating habits, and what we eat, and you know, and when I say what we eat, what we drink is sometimes more important than what we eat. Alcohol, the soda, you know. I remember I had a coworker once who'd be like, "Go to McDonald's. What do you want?" It's like, "Get me two cheeseburgers, the fries, and then extra large diet soda." You just defeated the whole purpose by diet soda. What is the point if we're doing extra large? I mean, you know, just stick to water if you can. Again, if you could see through it, it's probably better for you, not Sprite. But water. I think you know, that's the mantra here. Okay. Go to the next slide.
If the water is sparkling, it's still okay?
Yeah. Sparkling water doesn't have anything. It's just you know, bubbles. So yeah. No, not ginger ale. I know you can see through it, but good try. Sorry. Yes. It's not just banana. You know, avocados have potassium in them. Avocados. Apricots. A lot of fruits have potassium in them. Okay, but I guess my point in talking about the potassium is you don't necessarily have to load up on. You know, I don't want you to go to the store and say, okay, I will need potassium tablets and load up on that. Okay. What we want to do is have a balanced enough diet with fruits, vegetables, that will get you enough potassium in. For the most part, if you eat a balanced diet, you put fruits and vegetables in your diet, you don't have to worry about those numbers. You don't have to worry about how much potassium I'm taking in, how much sodium I'm putting in my body. Because if you portion it properly, right, if you take your plate, you cut it in 4. You put each food group in there. You know, I don't know about nutritionists and stuff like that. But you cut it in 4. You put your carbs here. You have your protein. You get your salad or, you know, fruits and vegetables on one side. You know, and to a certain extent, leave the last corner empty. You know, you're probably going to be okay. All right, but you know, the big one that we always say has potassium in it is banana. But the other, if you don't like bananas, apricots, you know, dates have potassium in them. I can't think, right. Yeah, the avocado pear, yeah. It doesn't necessarily, like, so everything we eat, we put in our body. If you do too much of it, it's not good for you. You eat too many bananas, it's a problem. Because you have, absolutely. Yes, absolutely. So everything in moderation is good. Okay, moderation. If you were going to have an avocado, for example, the recommendation is half, not the full thing. Yeah, they have the big one, just half of it. Whether it's the big one or the small, half. I think you'll be good. Yes, sir.
Before follow-up question to that. You know that these days we do hear that these vegetables are planted with some kind of medication in it. So are you concerned with that? Or when we say we go organic, how food is organic? So
Oh boy, that's a whole different topic. I can't even get into it. Listen, if you could afford to buy the organic stuff, stick with the organic stuff. If you can't afford to buy the organic stuff because it is pricey, probably just do the regular stuff. Okay, I mean, you're better doing the regular stuff than not doing it at all. If you just think about it. What do we have in those canned goods that we eat? It's processed stuff with salt in it and things that would just preserve it. It cannot be good for the body if you eat too much of that. Compare that to something that's fresh, whether it's grown organically or not. I mean, I'll take that. Okay, I'll take that leafy vegetable, whether it's organic or not, okay, over something that's in the processed container someplace. The important things are, the bad things for us are really sugar. The sugar is what's killing us. As a country, carbs, the sugar and the carbs. The carbs is mostly because of the portion sizes. We tend to have too big portions. We just have to be a little bit more reasonable and sensible with how we eat, and I think most of the time we'll be okay.
I put stuff including in my oatmeal and stuff, a little bit of honey instead of the sugar.
Yeah, that's a natural sweetener. I mean, honey is better.
Spain into that Amish country,
Yeah.
they had all this good raw healthy honey,
Yeah.
and it's so natural.
Give me some. Give me some next time we go. Okay, so quickly back to this. I'm going to kind of speed up a little bit. If you're diagnosed with diabetes, the important things are we've already talked about this. Seeing your eye doctor, the foot doctor for your foot care, getting your blood pressure under control. Cholesterol is the same stuff. Smoking. I know that's not a big thing in this room, but if you have friends and family that have blood pressure issues and diabetes, they need to quit smoking. Okay, that is the biggest killer we have. Okay, I can't even tell you. And then the last thing here is vaccinations. We'll talk about vaccinations later on, but if you have any chronic medical problems, please be up to date on your vaccines because that's going to save your life. Okay, all right. Let's go to the next one, please. Okay, so I'm kind of summarizing the diabetes and high blood pressure with this coronary artery disease risk factor. I mean, what this essentially means is, what are my risks for having a heart attack or anything happening to my heart? The biggest one is, of course, a history of having some other kind of blood vessel problem. I'm not talking about blood clots in your veins. I'm talking about blockages in your arteries, okay? There are some people who sometimes will have, they'll say, oh, you have a blockage in your artery to your brain, on your neck. So they go in there and they open that. Oh, you have a blockage in the artery to your leg. So they go in and they open that up. Whenever a big vessel this big is getting clogged with, usually it's cholesterol plaques and stuff, then think about the tiny little blood vessel that's going to your heart. Okay? So the risk of those getting clogged are just as high if you've had the big blood vessels clogged up. So any kind of blockages in arteries are usually a sign that you could possibly have problems with blood vessels in your heart. And we usually check for that. Your doctors will usually send you for, stress tests and things like that. If you're over the age of 55, your risk of having heart disease is high. If there's a family member, and when we talk about family member, we're talking about first degree relative, meaning your father, mother, brother, sister, sometimes grandparents, not your third and fourth uncle, no, not those ones. I mean, but really your close family members, if they've had some early heart problems, then your risk of having heart problems are also high. When I say early, men younger than 50, women younger than 60, you know. If they've had heart problems at that age, then, you know, you have to be very alert and make sure that you do your routine checks and stuff with your doctor, and they will probably send you for a stress test at some point, okay? If you have high blood pressure, diabetes, high cholesterol, or kidney disease, your risk of having heart problems or heart blockages are high. Postmenopausal women, if you're postmenopausal, whether naturally or artificially, your risk of having heart disease is high. There's a whole slew of reasons why, but basically it's a lot of hormone-related stuff. Okay, and when I say artificially postmenopausal, if you've had hysterectomies and you know, they've taken your ovaries out and things like that, that's what I'm talking about. Pregnancy-related complications also increase your risk of some of this stuff. Basically, if you had pregnancy-related high blood pressure and diabetes, your risk of high blood pressure and diabetes are higher. If you had pregnancy-related, you know, preeclampsia and all those things, then your risk of having heart disease later on is higher. This is kind of a soft one, okay? I don't want you to pay too much attention to that, but you know, it's just one of those things that I just wanted to let you guys know about. Okay, let's go to the next one. Yeah, so what do we do to help us to prevent, you know, us from having strokes, heart attacks, blood vessel blockages, things that basically will affect your lifestyle significantly. We've talked about the diet. I'm going to just move on from there. Smoking, avoidance and cessation, controlling your blood pressure, your cholesterol, exercise, weight loss, diabetes. Baby aspirin. Baby aspirin a day is good for so many different reasons. You know, I think if you could take it, if it doesn't bother your stomach so much, they have the little enteric coated ones. If you could take just one a day, it just does so many good things, right? Yeah, it prevents a lot of, especially the brain, and you know, they talk about it with the stroke prevention, and the heart attack prevention is one, and then they also talk about it with like colon cancer prevention. That's a soft one, but you know, baby aspirins, if you could take them, will be good. That's it.
Babies, right?
Yeah. What?
Call it baby aspirin because for babies.
Yeah. they used to give it to kids. That's why. Yeah. The aspirins that you could chew, you know. Yeah, because it's sweet and all. Yeah. So yeah, it's we call it. It's not the big one. It's a baby one. Yeah, it's a smaller dose. It's 81 milligrams instead of the 325. Okay, go to this one. Okay, so let's do a little cancer prevention now. Again, tobacco, being physically active, maintaining a healthy weight. You know, and when I talk about healthy weight, I'm talking about BMI. We've talked about the fruits, vegetables, and whole grains. Alcohol consumption, decreasing that. For some people, I mean, for most of us, I shouldn't say just for some people, sun exposure is big, okay? You know, when we talk about skin cancers and stuff, and we'll get to that, it's very important that you get the right sun protection and watch your exposure to the sun. So getting regular breast, colon, and cervical cancer screening is also very important. This is just to help prevent, you know, getting on top of things before it becomes cancer, okay? So that's what screening is about, okay? It's either catching things early or catching the things that will create the bad things early, okay? That's how we live a healthy life. All right. Next slide, please. So cancer screening, just throw all of them up there. The major risk factors for most cancers is family history. Okay, if anyone in your family, and I'm talking about again the first degree relatives has had some kind of cancer, your risk of having cancer is higher. Period. Okay, I could share my personal story with my family with you guys later. I'll talk about it. But there are some genes that we tend to carry that could be in the family and you would not know about it. So if you hear about your close family members, mother, father, brothers, sisters having cancer, pay attention. Find out what they had. I see people all the time there. So it's like, oh, my brother died of cancer. What kind of cancer? Oh, I don't know. Really? My father died. My brother, my father, and this person had it, and I don't know what they had. No, that's not acceptable. It really isn't. I mean, just pay a little bit of attention because it's important to you. And if it's not important to you, don't care about yourself, care about your kids. They need to know. They're going to come to you and ask you, oh, Mom, what happened to this person or that person? Oh, they passed away from cancer. And what kind of cancer? I don't know. It's not good. Okay, so let's just pay a little bit of attention. Okay, so breast cancer. One of the things I was looked at and I was kind of struggling a little bit with, and I wasn't sure how to address it, was the self-breast exam. They've talked about this for years and years and years. You check yourself, feel for lumps and X, Y, and Z, and the data is all over the place. Okay, what ends up happening is a lot of people might feel something. If you feel something, guess what's going to happen? You're going to get a biopsy, most likely. Okay, something feels weird, you go to see your doctor. They'll probably examine you. If they're not sure, you might get a biopsy. The recommendation is not to do it, but to learn how to do it properly. Okay, so if usually your primary care doctor or your OBGYN will teach you how to do a self-breast exam, and that is what you would use to follow. And it's not feeling for lumps per se, it's just noticing that things are different, okay? What they teach you to do is examine yourself the same time every month, because your menstrual cycles will definitely change the breast tissue, okay? So it will have to be around the same time every month, and being consistent with it, doing it every month. I just realized I left something out here, but I'll get to it. So doing the breast exam by your provider, whether it's your OBGYN or your primary care doctor, is important. Once you hit 40, you should get a mammogram, okay? Again, we have been talking about when should we do mammograms, should we do it early, should we do it late, should we never do it, all of this stuff. Get a mammogram. It actually picks up a lot of stuff. It saves a lot of lives. If there's a family history of breast cancer, you probably should be getting a mammogram a little bit earlier. It used to be 10 years before the person got their breast cancer, but now, some say 36. We're seeing younger and younger women with breast cancer now. So if on breast exam or for some reason something doesn't seem right, you will end up getting a mammogram. And then we'll take it from there. And there are things like ultrasounds and MRIs and different things like that they want to do. It's important that you follow through with these things. They'll send you to a breast center where someone will say, okay, this is what we want to do. Please follow through. Every week and every month counts. Okay, it's really important. Okay. So let me just share my quick breast cancer story with you guys because I think it's my mom passed away from breast cancer. Okay, she was diagnosed. We were much younger then. I was actually in college, med school, when she was diagnosed. She had the treatment, the full treatment, mastectomy, got her chemotherapy, and did great. We actually, she was in Ghana at that time. She came here. We had her checked out at one of the best hospitals here, Columbia Presbyterian, and she did great. And she went back home. They put her on tamoxifen, which is kind of like a medication to suppress things and stuff like that. She did very well. And then, the devil is a liar. And unfortunately, she got a recurrence. And it was 10 years later when she went off the medication, which is what we recommend. And she had a recurrence, and it had spread. It went actually to her spine. And, I have 3 sisters. We were all together. My dad called in a panic from Ghana. He says she fell, and she, it's like the commercial. She fell and she can't get up. She really fell and she couldn't walk. And immediately my head, the Spirit put on me what was probably going on with her. So we got her a ticket. I asked my dad to get her some medication, steroids to help inflammation and stuff in the spine, and we brought her here, and we took her to Vassar back then. So she was in the hospital initially for about 2 months because of how sick she was. She couldn't walk. She had all these issues. We started because again, when the Spirit tells you to do something, you do it. So because we had put her on the steroids, she was able to start her radiation immediately. My mother was a believer, God-fearing person, and she was amazing. Okay, so prayed, had a prophecy that she'd be healed. Okay. We prayed for more time as a family. We prayed for more time with her. That's what we prayed for. So she, one doctor saw her, said nothing we could do for her. Usually when you come in paralyzed like that, can't walk, that's it. We pretty much say, you usually don't regain anything back. So one of my colleagues says, let me consult this other person. And she did. The doctor came in, saw her, says, you know what, I'm going to cancel my whole schedule. I'm going to take her to the operating room today. I was like, whoa, where did that come from? Okay, and we had been praying. Took her to the operating room, did a big surgery on her, 6 hours. Recovery, ICU, the usual, She was in the ICU for a while. It was touch and go for a while. Then she got through that. Then we took her home. When we took her home, we were lifting her. I don't know if you guys know what a Hoyer lift is. It's like they put it underneath you, roll you, pick you up with it, and the whole 9 yards. She had lost everything from her waist down. She couldn't feel, she couldn't control anything. But God is faithful. So we took her home. She started getting the feeling back. We hired a physical therapist. Within a month, she was walking. Okay. Within a month, she was walking. Okay, and God gave us more time with her. She lived for 6 more years after that. She had chemotherapy. She had all sorts of stuff. Last year was very tough, but she lived 6 years. And the testimony for that, the growth, the togetherness as a family, what came out of that, I'll cherish for the rest of my life. What God showed us was amazing. Okay. And that's part of the reason why I'm here today. Okay? That's part of the reason why I feel as strongly about some of this preventive stuff as I do. Okay, so, one person in the family gets it. Okay. I have 3 sisters. I have sisters who are 2 years younger than me. They're twins, identical twins. One of them felt something in her breast. This was whilst my mom was still alive. Checked. Sure. Breast cancer. Again. That was alive. Okay. She went through her treatments and stuff. Completely. She had full works. Mastectomy. A young woman in her 30s. Yeah, this whole thing. Okay. And then went through it. She was fine. Did great. Just done great. Mom passed. Put her to rest. She went to the Lord. She would, sometimes and I'm going to talk about this because I think it's a discussion that sometimes we need to have. We wanted her here. We wanted her here to see her grandkids grow up and the whole 9 yards. But that's our selfish part. Where was she going? Heaven. No more suffering, no more pain. Okay? So when that time comes, we as a family have to learn how to say, it's time. Goodbye, go to the Lord, go and rest. We will see you again. Okay? And that is one of the things that I learned from it, and it's made me the physician that I am today. I'm able to help other people with it. I'm able to help my patients and their families with it. So every experience we go through, even as terrible as it might seem, there's a reason for it, and I didn't understand it until later. Okay. Anyway, so my sister has gone through this. Just last year, she had another something. And has gone through more treatment and stuff, and she's completely fine now. And praise God, I think she is healed. I know she's healed, and this is gone forever. Amen. Okay, so reason I say this is family history of breast cancer. You have to pay attention. Okay, it's not somebody had cancer. I don't know what it was. No, let's pay attention and let's keep on top of it. Okay, cervical cancer. The cervical cancer screening, is pap smears and stuff like that. At least every 3 years, every year or less in certain populations. And certain people who have, you've heard of HPV, if you have HPV, or if you've been told your pap smear was abnormal for some reason, you need to go back and follow up, okay? Don't wait, because these are all preventative things that can be prevented. If you sit on it, that's it. If you feel something in your breast, you're not comfortable, go see a doctor. Don't put your head in the sand and say it's going to go away. I'm going to pray it away. No, that's the reason why the Spirit showed it to you. Okay, it's time to act on it, all right? Okay, and God will heal you. I believe that completely. Ovarian cancer, it's something that we see occasionally. It's not really something we screen for, except in certain populations. Colorectal cancer, I'm talking more about colon cancer. You need a colonoscopy at 50, okay? If you've not had it, if you're 50, you haven't had a colonoscopy, talk to me after this. We could do one in the back. No, I'm kidding. No, I'm kidding. Honestly, there are a lot of gastroenterologists in the area. They are wonderful. Some women are not comfortable having a man doing a colonoscopy on them. We have women gastroenterologists in the area who are wonderful. I work with all of them. I should say I've worked with the majority of them, and they're all very professional and great. I would recommend any of them to you. Okay, so don't make excuses. Just get your colonoscopies, because if there's a polyp in there and they take it out, that's it. It's gone. If they leave it in there, 5 years it's growing. 10 years it's cancer. And 10 years it would have spread everywhere. And now we are fighting a battle that we never should have come to. Okay. Colonoscopies, that's like the easiest thing you could do as far as this cancer screening stuff is concerned. Pap smears, colonoscopies, easy. Okay. Lung cancer, that's really for the smokers, 55 to 74. They do these low resolution CAT scans now to follow them. That's if they've been smoking for what we call 30-pack years. You know, if somebody's smoking 2 packs a day for 15 years, that's 30 years. 30-pack years straight. Okay, so it's just something that to think about if you know anyone who's a smoker. Prostate cancer screening. Okay, and so now I'm going to come back to this. Let me know. No, men, guys, come on. Go and see your doctor. Get your PSA done. I hate that digital rectal exam, but you know what? It's the women do their what do you call it? Their annual pap smears every year. They don't complain, you know. And they do for that they do. I mean, I won't get graphic with it, but you know, we should not be afraid of this. Okay, we should not be afraid of it. So let's get on with it. And with that also comes the testicle exams and stuff like that. You have to do that, especially the young men going to college and stuff. I can't tell you how many people have picked up testicle exam themselves just by doing the manual examination. They get surgery and whatever else, and then they do fine. You sit on it, you wait, that's it. And then, you know, the last one is melanoma screening, you know, the high-risk population. If you have some kind of, some moles on your body and stuff like that, we need to look, you know, you need to have the mole checked, you know, and it needs to be checked by a trained eye, which is a dermatologist. It's not just for the light-skinned people, okay? Some of us dark-skinned people have some moles that look very strange. Sometimes it's in your palm or on your feet. And those could turn into skin cancer, okay? So they need to be looked at, okay? So, can you go to the next slide, please? I've been told I'm being too slow. Okay, so I'm kidding. Okay, immunizations, just put all of them up there. Flu shot, who got their flu shot last year? All those who didn't, shame on you. That's the one thing. We're going to have a fight here. You know?
Yes.
Mm-hmm.
Yes. I got that.
If you get to the pulpit, you're going to win. No. No, sit.
Some people, when they don't get the flu shot, they're fine.
Yes.
And it's very rampant.
Yes.
American. My mom was an example.
Me
And
too.
I took her to the doctor. She was fine.
Mhm.
But as soon as she got that shot, for 1 year, this woman was like that.
I can't explain that to you. I don't know, okay? There are some people, if you've had a side effect to a vaccine, and it's not just a flu shot, I mean, it could be any of the other vaccines up here, you probably should stay away from them, okay? Okay? If you've had some kind of side effect, but you can't, you know, that thing where, oh, I got the shot and I got the flu, come on, people, really? No. You probably were exposed around the same time you took the shot. That's what happened. You waited too long. If you got the shot early enough and were not exposed, guess what? You probably will be okay. What it does do is it gives you some protection as far as the flu is concerned. Okay, it protects you from getting so sick. And trust me, I mean, Jackie just left here. I would have let her tell you guys. Every year we see a couple of young people who gets into the ICU intubated. and people die. Unfortunately, it's usually our older people and our very young people, okay, the kids, okay. If you get the flu, it's not you I'm worried about, it's the kids and the grandkids, okay? It's the other sick people around you. Yes.
Is the flu shot mandatory for children?
No, it's not mandatory for anybody except healthcare workers.
Okay.
And even that, we fight people. I mean, I'll be honest with you. But if you get the flu, I mean, just besides the fact that you could get incredibly sick, you get so many other people exposed, and it's just, it's, you know, when we grew up in Ghana and stuff, we had to say there's a free clinic and they're given free vaccines. Everybody lines up and gets it. Here, you have to fight people to get vaccines. When it's something that actually protects you. Yes, Sharon.
I'm sorry, but the flu shot,
Yes.
you get the flu shot,
Mhm.
are you guaranteed not to get the flu?
No, you're not. No, you're not.
But you're
But-
just saying, you're just saying that it lessens the,
Yes.
so my question is this, if you're, for the most part, if you have a strong immune system,
Mhm.
you're very proactive and try to stay healthy.
Yeah.
That would also help reduce the severity of, but if you're a person who cannot stay on top of your health, you have a weakened immune system,
Mhm.
maybe I can understand getting a flu shot. But
I think.
I'm sorry.
Yeah, no. It's, and we're amongst friends here. So, I mean, it's a discussion, an active discussion that we have. This comes up every year. How effective is this flu shot? Sometimes it's not at all effective. I took a shot and it did nothing. And that's what we all worry about. Or I took a shot and I still got sick, okay? And we worry about that as well. The issue isn't necessarily us, okay? It's not just you being able to get through it. If you get exposed to the flu, I don't care how strong your immune system is, you're gonna have some symptoms, okay? If you get, you're gonna have, yeah, but you might be fine, but it might be somebody else that you're exposed to the flu that would not do well. That's what we worry about. It could be, you know, your neighbor. It could be, you know, someone at the bank, at the grocery store. Yes.
So if you get the vaccine and you have a strong immune system, is that like a double up?
No.
No?
It's just, yeah, it just protects you.
Alright.
It just protects you. And the point in getting vaccines is something called herd immunity, okay? If we immunize half the people and they don't get exposed, then the chances of the rest of the herd getting getting sick is less. You know, the rest of it, everyone else getting sick is less, okay? So it's just trying to, the more people we immunize, the better it is for everyone. And that's just for the flu. This other stuff is different, okay? So tetanus, diphtheria, and pertussis, that's all vaccination. That's a vaccination we get as kids and stuff. We get a booster when we go to college and stuff. If you don't go to college, get a booster, you know. And if you are more than 19, you should probably get a booster every 10 years. We forget, you know. Especially the tetanus shot, you have to get your booster after 10 years. We've been seeing outbreaks of pertussis in the community, and people could get pretty sick. You'll have a cough that will never go away for like months. Yep, that's it sometimes. Varicella vaccine, that's for the chicken pox. If you've not had the chicken pox, then you're more than 13 years old, then you should get immunized. I got the chicken pox, I think, the summer before I went to college. That was the worst thing that could have happened to me. And I only got it on my face. That was horrible. It was the worst. I couldn't eat. It was in my mouth also. Horrible. I wish they had the vaccine then. The Zoster vaccine is essentially it's the chickenpox vaccine for adults. We recommended it for people over 50, but if you're 65 and above, it's highly recommended. Just get it. Pneumonia vaccine, get it. Meningitis vaccine, HPV vaccine. Anybody has any questions with these things? I want to just kind of wrap up. Yes.
So for all these vaccines, apart from the first influenza, so doctor tells us when it's due for us, or do we have to tell the doctor about all these things?
Well, they will offer it to you. I mean, they'll offer it to you. I mean, what I tell people to do is when you're offered something, just ask questions, pluses and minuses and stuff, and educate yourself. Just read. There's a ton of, I mean, today it's easy because there's a ton of stuff on the internet. Just don't read the bad stuff because there's too much information there. Go to the national site. You'll see, if you see CDC, that means it's a good site. That's the government site, and it will tell you the information you need to know. But you know, these are all important things to get and to be updated with. Go to the next slide, please. Sure.
Can we see get the flu vaccine after the experience?
You probably shouldn't get it if you've had the flu. I mean, because you have the antibodies already. So yeah. This is real quick. Tick-borne diseases. Who's heard about ticks and the tick-borne stuff? Yeah. Okay. Go to the next slide for me. So Lyme, Babesia, and Ehrlichia. This is very quick. This is the tick that we worry about. Okay. This is the deer tick. Okay. It carries all three of those. The Lyme disease. There's something called Babesia. That's kind of like malaria. Okay. It kind of kills your red cells. And there's something called Ehrlichia. That one we don't really understand well, but it's another disease. That we have medication for all to treat all three of those things, but you have to be diagnosed early. So if you see a tick like this on your body and it's been there for about 48 hours, okay, you probably should talk to your doctor. Now, how do you identify this deer tick? You see, it has black legs. Okay, click to the next page for a second. This one is the dog tick, brown. You see the brown leg. So most of the time, you know, you'll find the dog tick. It's definitely different from the previous one. Go back again. Yeah. Yeah. The black legs is the deer tick. They actually have tick identifying clinics and stuff around now. You could take the tick off, put it in a plastic bag, take it off with forceps, put it in a plastic bag, and you could take it there and tell you what kind of tick it is. If the tick has been on your body for about 48 hours or so, and the only way most of the time we don't know, we really don't know. So once you take the tick off, if you suspect you've been exposed to it, it's been more than 48 hours, you probably should go talk to your doctor. They'll probably draw some tests, or they might give you a prophylactic dose of medication, okay? If you pull a tick from your body, you have a fever, things to look out for, rash. If you have a rash on any part of your body, it's important. Sometimes it will be at the site that you pull the tick off. Talk to your doctor, go see your doctor, and we'll treat you for the Lyme disease or whatever else it could be carrying. The dog tick does not carry anything that we know that affects the human, but the deer tick is the one that carries the Lyme disease. Okay, and click through, and that should be the last slide. I think that's it. Oh, that. So I put that picture in. This is South Africa. That's called 12 Apostle Mountain. Okay, and literally it's a chain of mountains, and it's like it has 12 heads, and they call it a 12 Apostle Mountain. You never see all 12 of them at the same time because there are always clouds up there. And I think Judas never shows his head. No, okay. That's my talk. I'm done. So, any questions? Sure.
Questions, doctor?
Yeah.
The first one, when we go for the high blood pressure, when we go to the CVS or all this, that machine, is it accurate?
If your pressure, I don't think you should use that machine as your guide for the blood pressure. The recommendation is it should be checked by your doctor, and not your doctor, but it should be checked in the doctor's office. They sometimes will say they'll get you a machine to check at home, okay? And doing several checks will help you diagnose it. If that machine is really high, if you put your arm in there and it's really high, there's something wrong, man. You need to see the doctor. Because there are a couple of things that the machines have to do. The cuff has to be the right size for your arm, okay? And a lot of times, they use the wrong size cup. If it's too small, it's going to come out hot. So it needs to be the perfect size to be able to measure the blood pressure accurately. Okay.
My two questions, sorry. My second question is, Doctor, I know as a medical person, when you talk to us now, you're going to wear medical hat, and as a minister, you're going to wear a spiritual hat. I'm trying to find that medication and faith conflict in this. Because I'm sure I know somebody.
There is no.
I know somebody close to you. When she's fasting and she has headache, she will not use medication.
No.
So talk to us about
No,
this
no,
conflict.
okay. I could share another, that's a good question, that's a good one. I could share another personal story. I have an uncle who is kind of a little stubborn. He was Christian, very spiritual, and he was diagnosed with high blood pressure. He actually had like what we consider a mini stroke. He was diagnosed with high blood pressure and was put on blood pressure medication. Took it, was taking it faithfully, and he decided he was going to do a fast. Now in fasting, he does not put anything in his mouth, including his medicine. Guess what happened? Stroke. He was paralyzed. And he lived probably 10 more years afterwards, and it was horrible. And he eventually passed away from complications from his strokes, not just one, but several. Okay. Let's not be stupid. Okay. God has given us all of these things, just like God has given us all these different foods for a reason. Okay. God says, I will heal you. It doesn't mean that it's just a touch that will heal you. Sometimes that's what it is. Okay. There are times that all it takes is that touch. Okay. But sometimes there are things like, look, if you have high blood pressure and you're eating all the wrong things and you're overweight and you're praying, there is also gluttony. That's also a sin. Okay. So let's just be smart about it. Okay. I'm a Christian and I'm a doctor. I'm not taking the position of some of the people in my field who say there's nothing, they don't believe in the spiritual. No. I know what I know. Okay. But I'm also a doctor, and I've done the science, and God has shown us the science. And you listen to the Spirit. Listen to the Spirit. That voice is always there, and it's never wrong. There are times people come to me and ask me some of the questions, and it's like kind of like spiritual matters slash person. And I'm like, okay, what is the Spirit telling you? Okay, don't ask me. I'm a man. Go and ask God. Go and ask your Father. Don't ask me. And if you ask and you listen, and that means being quiet and actually listening, you get your answer. I don't have to tell you anything.
I just wanted to mention, you talk about making good choices for the food and exercise and so on. But stress is something that we need to really take a look at, because that affects us all across the board.
I agree.
Yeah. No matter what.
Stress is on the list of stuff. I just didn't put it there because I think it goes without saying. Okay, it affects your risk of high blood pressure, diabetes, heart disease, all stress and emotional stuff. Okay, but as Christians, I mean, what we learn is to take it to God and leave it there, right? So take it to the altar and leave it at the altar. Okay, what can you do about it? Nothing. So then stop worrying about it. What can you do about it? I could do something about it. Then go do it. If you can't, it's very simple. It sounds very simple, but if you could do something about it, do it. If you can't do anything about it, stop worrying about it. It's easier said than done. Trust me, I go through the same thing. But if I could do something about it now, I'm learning. I'm getting older. I'm getting smarter. Working smart, young ones. Working smart. The thing is working smart. If you could do something about it, do what you can do about it, and that's it. Okay. Someone else had a question.
This will be my last question.
I'm not taking another question. No, okay, go ahead. Go ahead.
You talked to us about cancer, and I don't know if this is fake news, but we really that microwave sometimes causes cancer.
Yeah, it's. I wouldn't worry about that. Okay. What I do myself is when I turn on the microwave, I stay away from it. Walk away.
Everything in moderation.
Moderation. Yes.
So I
Yes.
saw an article used as a goal saying oatmeal causes cancer.
No.
Well, fake news.
That's fake news. That's probably fake news. Yeah, go ahead.
Because in these countries, they look like you have to take supplement. It's not, I mean, I think some nutrition classes, the teacher here, if you don't need them, if the doctor doesn't prescribe them to you, you shouldn't have to, like, all you hear is, everybody needs to take supplements.
Yeah, well, that's the pharmaceutical industry that wants you to buy their stuff. So, somebody wants to make money. I think a multivitamin is good to take. In the wintertime, it's amazing. If anyone has ever had their vitamin D level checked, it's low. All of us. And why? Because we don't expose ourselves to the sun enough. So in the wintertime, vitamin D is important. And stuff. Just taking a couple of those vitamin D pills. I mean, I'll take like one every day or so. For women, I didn't go into the osteoporosis stuff, but calcium is important. If you're not a milk drinker, calcium pills are important. Just don't overdo it. I think too much of it is also an issue. They have all these recommendations, and I look at them sometimes, and I'm like, oh my God, what are we doing? You can't. We see people with all these medications. There'll be like 3 prescribed, and then they have like 10 different supplements. I think that's dangerous because you don't really know what's in those supplements. Honestly. So just be careful, make smart choices with those things. Multivitamin, vitamin D, calcium. That's where I'll stop. The rest of the stuff, fish oil, they're all. If you have a balanced diet, you shouldn't really worry about too many of those supplements. Okay? So we just have to eat smart. That's what it's all about. Okay? God's people, thank you. Okay, go ahead. No, one more question. Let me see.
I have a question.
Sure.
It's not concerning what you talked about, and it's arthritis. So I really want to know what causes arthritis and how can you prevent it?
Yeah, different types of arthritis. Okay, there's some are caused by the body fighting itself. That's what we call autoimmune arthritis. And then there's arthritis that we get just from getting older, using joints, and being hard on our joints. If you play sports, you're going to have some arthritis in your joints. If you are a little heavy, you might be, because you're stressing your joints, so you will have arthritis in those joints and stuff like that. The only thing we know to do with arthritis is moderate exercise, not too much, but a little bit of exercise. You need to stretch the joints and stuff, getting your body a little bit stronger, the muscles, okay? And occasionally you take Tylenol or Motrin or something like that to help you through it. When the joints get bad enough, then they have to be replaced, unfortunately. You never want them to be done too early, as far as joint replacement and stuff, because they don't last forever, okay? So they'll have to do them again, okay? So in countries in Europe, they actually hardly ever do joint replacements until they absolutely have to. But here it's, ding, 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 ding. Thank you guys so much.